Hi, my name is Dr. Joe Sturges here at Sturges Chiropractic and Sports Medicine, and I'd like to take a few moments today to explain to you one of the more common techniques that we use here in the clinic to treat a plethora of sports injuries, but very commonly treat the injury that we're showing today, which is plantar fasciitis. So what I'm going to show you is a technique called Graston technique, and it's a wonderful technique, was developed a few decades ago, originally to break up post-surgical scar tissue, but it has just morphed in just a wonderful technique that's used in all avenues of sports medicine to treat a variety of conditions. So with Graston, we use a few of these different tools. They all have different angles, different bevels on them, kind of depending on what area of the body we're treating and how deep in the tissue we want to go. And really what we do with the Graston is use the tool to scan the muscle that we're working on. In this case, the gastrocsoleus muscle. And we're really using it for two different purposes. One is I'm just lightly scanning for any adhesion or scar tissue or knotting in the muscle. When I find an area that is adhered or feels like perhaps there's some scar tissue built up in it, we then just take the tool at a variety of angles in different directions and really use it just to kind of strip through that tissue and break up that adhesion. The wonderful thing about this technique is it treats not only the symptoms of, in this case, plantar fasciitis, which is foot pain, but really the underlying cause of it, which essentially is a lot of the constriction and adhesions that have built up, not only the gastrocsoleus muscle, but the Achilles and eventually even into the bottom of the plantar fascia. So again, as we work our way through the calf muscle, both directions, as we localize any adhesion, we spend a little bit of extra attention on that spot. Oftentimes, I'll have the patient go ahead and move the foot up and down. So go ahead and move your foot up and down for me. Yep, keep it there. There you go. And what that's doing is just shortening and elongating the muscle that I'm working on, which again makes it a little bit more effective as far as getting in there and finding where those adhesions might be. As we then work into the bottom of the foot, again, the plantar fascia running from the base of the calcaneus or the heel into the forefoot will again take that tool, lightly scan for those areas of adhesion. As we find them, we'll spend a little bit of extra effort in that area. And a lot of times I'll describe to patients what I'm feeling for is almost like the grate on the side of a highway. If you get your tire over a little bit too far and you kind of feel that rumbling, that's kind of what the adhesion oftentimes will feel like in here. And again, if I find an area that's just a little bit more robust than the surrounding areas, oftentimes we can switch and use one of the different tools that might be just a little bit more pinpoint in its action to get in there and to break that up. Just like so. There we go. So Graston is very commonly used in conjunction with just traditional rehabilitative exercises and stretches as well. In this case, I'll oftentimes have patients use some moist heat if they're a little bit sore from the technique. Certainly stretching out the gastrocnemius muscle is very, very important. Sometimes we can roll the frozen water bottle on the bottom of the foot, or maybe a golf ball or one of the different foot massaging balls that they have, just to kind of help flush out some of that, maybe a little bit of the swelling or even a little bit of the inflammation that could be left in there. But typically Graston, for a case like this, you're looking at about 6, maybe 6 to 8 sessions, kind of depending on how long it's been there for and really how much of that adhesion we're having to break up. But if this is something that sounds like might be a technique you're interested in, feel free to give us a call here at the clinic and we'll be happy to kind of set you up for a consultation, maybe an evaluation to see if this might be something that would be beneficial to you as well. Thanks.